Hi everyone, Dr. Orna here. Today I want to talk to you about using herbs topically as opposed to by mouth or orally. So most of what I work with is mental health and chronic disease. So for the most part what I'm doing is giving people herbs and their other supplements by mouth so that it gets into the bloodstream and works through their system to tweak things to affect how their body responds to things and get at diseases from the inside. But there are some times when the disease is on the outside or when there's some kind of an acute condition that you want to get the herbs to doing their work directly in a specific area. And so a topical application of herbs is really useful for that. So a couple of places where we would want to use topicals would be, first of all, skin. Second would be muscles or specific muscles, like if you have been working out and you have an area that's particularly sore, doing something right on that area can be helpful. Or if you have muscle tightness because of the way you tend to hold your body, getting some herbs to help relax those muscles locally can be very helpful. And then also sometimes when there is nerve pain in a particular area, you want to get the pain relieving herbs directly to that site. So applying the herbs topically can be super helpful. Now, there are a number of different ways that we can use herbs topically. Sometimes we can just smush them up and apply them. Another way that's commonly used is to make a strong tea or a decoction and then use that as a wash or a soak. Another way to do herbs topically is in an alcohol extraction, so a tincture or a liniment. One thing with liniments is that usually they are alcohol extracts of the herbs and they are often made with isopropyl alcohol or rubbing alcohol, and you can't take those internally. So when I'm making medicine, I almost always use alcohol that's okay to ingest just so that it can be used in a multifunctional way. So you have more options. You don't have to worry about that is not safe for internal use. And then also we can extract herbs in oils and then use those topically as well. So the caution when you're using a tincture is you don't want to use, or an alcohol extraction topically, you don't want to use it on an open wound because obviously that would hurt. And there's a caution with oils as well that there are certain kinds of bacteria and funguses that will thrive when they're covered with the oil. They'll thrive and spread. So you want to sort of be cautious with when you're using the different applications. Now with oil, so I wanted to talk about this because I often prescribe people tinctures and tell them to just apply them to the skin. And so a lot of people don't know how to do that. They haven't done it before, and it's just super easy. You just put some in your hand and rub it on the affected part. And I usually do that with tinctures. I don't use oils as much in my practice. And as I said, I tend to use tinctures for dual purpose. Now, when you're using a tincture or an alcohol extract, pretty straightforward. When you're using oil, there are sort of layers of fancy with it. So you can have just a plain oil. So here is an oil that I'm infusing. This is jojoba oil and Laurea tridentata, which is one of my great favorite anti-infective herbs, and it's also really helpful for sunburn. So you can just use the oil like that topically. Or you can do fancier preparations with it. So you may have heard of salves, and then obviously creams and lotions, which you can medicate. So this is a salve that friends of mine made a couple of years ago. I haven't used it, don't tell them. And basically what this is the oil and maybe some essential oils as preservative and for fragrance. So just extracted oils like I showed you with that jar before, and they add beeswax so it becomes solid. And then you can just grab some and massage it wherever you need it to go. Another way that you can sort of fancy up your oils is to make creams. And creams have a little more water in them, so they tend to be lighter than salves, and they tend to be a little less greasy because they aren't just wax and oil. And then there are lotions which have even more water or aloe or that kind of a liquid component to them. So just looking at my notes. So two of my favorite herbs to use topically are St. John's wort. I want to just show you this because it's super cool. St. John's wort oil. It's this beautiful red color. Let's see if I can do this without dropping it. And St. John's wort is fabulous, fabulous, fabulous for nerves and nerve pain, and really almost any kind of pain, because obviously pain comes from the nerves, right? So if you have shingles, for instance, St. John's wort might be nice to put near where that outbreak is, not necessarily directly on the lesions. If you have any kind of jangly nerves or low back pain, anything like that, it can be very helpful for dealing with the pain. My other favorite that I use topically, really very commonly in my practice, is lobelia. This is the tincture. It's actually made with alcohol and a little bit of vinegar because it extracts the constituents better with some of that acid. And usually I just have people use the tincture and apply it topically for muscle spasms, really of any kind. So if you have sore muscles, you could use it. If you have, if you've sprained your back or you've tweaked your neck, it can be really useful. I have my patients who have tension headaches use it. So they rub it onto whatever muscles are tight behind the neck, down the neck, shoulders, to help loosen things up and relieve the underlying cause of the tension headache. Now, another cool thing about using these herbs topically is that both of these herbs have some limitations taken orally. So St. John's wort has some interactions with other pharmaceutical drugs, so not everybody can take it, or they have to be very careful in their dosage. And lobelia, if you take too much, it will cause stomach upset, and it can cause nausea and vomiting. So generally, taking these herbs as topicals, we don't run into those problems. So those are some of my favorite herbs to do topically. And again, there are many, many ways and many different herbs that you can use in this way. So these are just a few of my favorites. If you have others that you really love and you'd like me to talk about, please let me know. Please do like, save, share, follow this video. It helps me reach more people. And I hope that you enjoyed this, and stay safe and stay well. Bye.